With Libby Znaimer on Zoomer Radio with guest host Jane Brown.
Libby returns tomorrow. She kindly stepped aside today to grant me an opportunity to talk about my favorite charity during this Bladder Cancer Awareness Month. It's a bittersweet segment for me since my mom, Sandy, died with bladder cancer back in 2012, so I advocate for Bladder Cancer Canada in her memory. Joining me as they do every year, Ferg Devins, bladder cancer survivor and chair of Bladder Cancer Canada, and Dr. Alexandre Zlotta, director of Uro-Oncology at Mount Sinai Hospital, professor in the Department of Surgery, Urology at the University of Toronto, and member of Bladder Cancer Canada's Medical Research Board. Ferg and Dr. Zlotta, welcome to both of you.
Hello, Jane. Nice to be here.
Ferg,
hello.
Well, my feeling, Ferg, is that more people have become aware of bladder cancer in recent years because of the incredible work of your team at Bladder Cancer Canada. People are seeing the bus boards and the billboards, which are really striking and send home the message that if you see blood in your urine, see your doctor.
Yes, it's certainly one of our primary campaigns is the See Red, See Your Doctor campaign. Currently, it's the image of a lemon being squeezed, and it's a drop of blood. Mm-hmm. And the point there being is a lemon should be yellow, and so your urine should be yellow. So if you see blood in your urine, you should see your doctor. And I think the most important thing to reinforce, particularly during these COVID times, Jane, if it happens once, you should call your doctor. And I'm sure that Dr. Zlotta would reinforce that.
Well, right. Dr. Zlotta, what is the first thing you do if you see blood in your urine even once?
I think, as Ferg said, you absolutely have to consult. Don't neglect. And I'm going to repeat what I said last year, which is I really think that the hospitals are the safest places in our entire country and province. Basically, nothing happens. The screening is so tight that nothing happens. So you carry and risk nothing by consulting.
And by the way, I have Ferg and Dr. Zlotta until 1 o'clock. If you have a loved one who has bladder cancer, if you have bladder cancer yourself, if you have any concerns, you'll want to grab a line for this segment. The numbers to call are 416-360-0740, toll free 1-866-740-4740. Dr. Zlotta, you would know this better than anybody during COVID. If you're seeing blood in your urine and you've told your family doc about it, you may not be able to see a urologist right away.
Yes, but on the other hand, honestly speaking, I think we all, and I speak on behalf of all my colleagues, have done the extra work and went the extra mile to be able to see patients and people in that condition. And so, to the best of my knowledge, in terms of diagnostic workup, everything has been done to really optimize. We live in unprecedented times for sure, but by far and large, we've been able to help people who presented with, blood in the urine, for instance. Yeah.
Now, when it comes to diagnosis, Ferg, there are two types of bladder cancer. Can you get into that for us?
So, non-muscle invasive bladder cancer, and that's what I had back in 2014. That was two tumors that were on the inside of the bladder. They were really inside the surface of the bladder, and so I had what's a procedure called TURBT, which is basically to go in and surgically I was put under, and they remove those tumors from inside the bladder, scrape them out, if you will, make sure they've got all of the margins of the tumors. Now, I was high grade, so following that, I underwent up to 18 treatments of a treatment called BCG. People can see the explanation of that on our website at bladdercancercanada.org. So that's non-muscle invasive bladder cancer. I still have my bladder. I was very fortunate, and touch wood, since 2014, I've been all clear ever since. The other is invasive bladder cancer, and oftentimes that's when the Dr. Zlotta likes to call it the tiger versus the pussycat, and it becomes very aggressive, goes into the wall of the bladder, can be penetrating the wall of the bladder, and that's when the bladder has to be removed through what's known as a radical cystectomy. And then Dr. Zlotta can probably enlighten us on some of the options that patients would have with respect to urinary diversion if the bladder is removed. There's also metastatic bladder cancer, and I raise that because I unfortunately lost a friend just last week to metastatic bladder cancer.
Oh, Ferg,
he succumbed
I'm
to that
sorry.
disease. Yeah, he had a kidney removed 3 years ago, and as it turned out, it was bladder cancer, and that kidney, it was metastatic bladder cancer. So, I think it's important. The big thing here is you catch it early. I was very fortunate. I had some strange back pain. I went to my doctor, had a CT scan. It showed something in the bladder. I was off to see my urologist at Sunnybrook Health Sciences, and they caught it early, and I got them out of there, and I still have my bladder today. So if you see blood in the urine, for gosh sake, folks, you make sure you call your doctor.
Dr. Zlata, let's talk about the alternatives for those who've had invasive bladder cancer and need to have their bladders removed. My mother was one of those, and she was living quite normally for a year until we realized that her bladder cancer had actually traveled to her lungs and other parts of her body. And once that happens, survival, it is almost negligible. There are some cases where people do survive, and I know that has changed a lot since 2012. So talk to us a little bit about how that all works once you lose your bladder to cancer.
So, first of all, let me just emphasize, and Ferg is absolutely right, that what has changed a little bit compared to probably 15 years ago is that not every single tumor, which is a tiger and that invades into the muscle, needs necessarily now to be removed with the bladder. Most do, but we have what's called a bladder preservation program where tumors which are less than, say, 3 inches, which are isolated and single, not multifocal, and that don't push on the ureters, we can actually do what's called trimodality therapy, where the tumor is resected, like Ferg had his entire bladder tumor shaved, and this is then accompanied by a short dose of chemotherapy, low level, and then radiation therapy on the bed of the resection. And we showed a couple of years ago that at 5 or 10 years follow-up, the results were equivalent for a subset of patients who fell into this category. And we're actually expanding with a large multi-center in North America to prove this further. So I think the reassuring news is that in the past, yes, it was always the removal of the bladder. Now it's not necessarily, and this should be discussed. Now,
Amazing.
If the bladder has to be removed, either you reconstruct a new bladder using bowel. This is called a neobladder with small bowel. This works usually in men and women who are reasonably young, not because you can't do it later after the age of 70, 75, but simply because the sphincter is a little bit weaker with age, and therefore the risk of incontinence above a certain age is high. Mm-hmm. Or, depending on the location of the tumor and the type of tumor, one actually reimplants the ureter in a piece of bowel that is actually then brought to the skin. That's called an ileal conduit. Or in some circumstances, we're able actually to do a pouch of right colon, which can be catheterized through the umbilicus, and that's called an Indiana pouch. So there's a variety of ways to divert the urine from continent to non-continent. But the key message is that in contrast to what people would anticipate, and logically, the quality of life of people who underwent that surgery is surprisingly good, and humankind adapts to a new situation, and that's really the key message.
It's Bladder Cancer Awareness Month, and joining me, Jane for Libby here on Zoomer Radio's Fight Back, Dr. Alexandre Zlotta and Ferg Devins. of Bladder Cancer Canada. Dr. Alexandre Zlotta is a foremost uro-oncology expert here in the city of Toronto and also a member of Bladder Cancer Canada's Medical Research Board. We do have some calls. We have some Zoomer Radio listeners who want to speak with you both. Since it is Bladder Cancer Awareness Month, Ferg, let's talk about where bladder cancer is falling in the lineup of cancers in Canada, how many people get it each year, and survival rates when it's caught early.
So we've got somewhere around 11 to 12,000 patients that would be diagnosed in a given year across the country. We say that our community is about 80,000 bladder cancer patients across the country. And in fact, Jane, we have about 7,000 subscribers to our Bladder Cancer Canada newsletter. So in the Awareness Month of May, Bladder Cancer Awareness Month, really we have two purposes for awareness. One is to raise public awareness about the disease because, as you asked, it's the fourth most prevalent cancer for men in Canada and 12th for women, making it the fifth most prevalent cancer overall. So we really need to get the word out there. So that's important. The other important thing is that we at Bladder Cancer Canada are here with some plentiful resources to support those patients along their journey. After they leave that doctor's office, oftentimes there are questions that are not medical questions, but it's really lifestyle questions. How do I tell my family? How do I now plan for my journey? What's this thing they call cystoscopy? There's a number of questions that the patient has in mind, and we have the resources to support those patients, whether that's online through our discussion forums at bladdercancercanada.org or through Twitter, Facebook, Instagram, and our YouTube channel. We also have patient guidebooks on our site. So we're trying through Bladder Cancer Awareness Month and hashtag Bladder Cancer Aware to attract as many patients across Canada as possible to join us at Bladder Cancer Canada.
Excellent. All right, what we'll do is take a quick break and then get back to your phone calls. I'm inviting you till 1 o'clock. If you have bladder cancer, if you have a loved one with bladder cancer, Dr. Alexandre Zlotta and Ferg Devins are here to answer your questions. Here are the numbers again, 416-360-0740, toll free 1-866-740-4740. Your questions and answers coming up next.
Available 4Motion all-wheel drive? Check. Turbocharged engine? Check. German engineering? Check. Drive with confidence and get a great deal on a German-engineered Tiguan during Volkswagen's Autobahn for All event. Get 0% financing for up to 60 months on select models. Plus, complimentary 3 years, 45,000